What is diverticular disease? Diverticular disease, also known as diverticulosis, is a progressive condition in the intestinal system. Through time and with aging pressure inside the colon, large intestine, causing bulging pockets of tissue, sacs that push out from the colonic walls. This bulging pocket is called diverticulum or diverticula if we are referring to more than one. Diverticula are most common in the area near the end of the left colon, which is called the sigmoid colon. What causes diverticular disease? It is said that increasing pressures required by the colon to eliminate feces is one of the contributions to cause of diverticular disease. A food that contains inadequate roughage and excessive amounts of highly refined food produces small caliber dry stools which fail to descend the bowel lumen. A diet with low fiber can lead to small, hard stools which are difficult to pass and require an increased pressure to pass. The lack of fiber and small stools are also may allow segments of the colon to close off from the rest of the colon. When the colonic muscle is the segment contracts. The pressure is in these closed off segments may become high since the increased pressure cannot dispatch to the rest of the colon. Over time, high pressures in the colon push the inner intestinal lining outward, peroneation through weak areas in the muscular walls. What are the symptoms of diverticular disease? The majority of people with diverticulosis have found few or many causes, no symptoms. Some people will develop the following symptoms: abdominal cramping, constipation, and diarrhea. These symptoms occur to difficult in passing stool through the left colon, which is narrowed by the diverticular disease. These symptoms occur due to difficult in passing stool through the left colon, which is narrowed by diverticular disease. Diverticulosis can have serious complications such as diverticulitis, collection of pus, abscess in the pelvis, colon obstruction, generalized infection of the abdominal cavity, bacterial prognosis, and bleeding into the colon. If a diverticulum ruptures, the bacteria within the colon can spread into the tissues surrounding the colon, causing diverticulitis. It can get even worse. Sometimes pus can spread around the inflamed diverticulum and can lead to formation of abscess, usually in the pelvis. Some causes, the inflamed diverticula can erode into the urinary bladder and can cause a bladder infection and passing of intestinal gas in the urine. Inflammation in the colon can also lead to colonic bowel obstruction. When the expanded diverticulum erodes into a blood vessel at the base of a diverticulum, it can cause bleeding. Rectal passing of red, dark, or maroon-colored blood and clots occur without any associated abdominal pain. Blood from a diverticulum of the right colon may be black in color. Bleeding may be continuous and intermittent, lasting several days. Be happy. Don't worry. There is a solution. If you take care of yourself, you can have a healthy life. You can have a